Is honey safe to eat if you have type 2 diabetes? Honey raises blood glucose levels and is classified as a free sugar under UK guidance, so it should be used sparingly and counted within your daily carbohydrate allowance. Is honey actually safe for people with type 2 diabetes, or is it just a healthier sounding version of sugar? That's a really common question, and the honest answer might surprise you. Honey is still sugar, and for people managing type 2 diabetes, it needs to be treated that way. Before we dive in, this video is general information for adults in the UK and isn't a substitute for personalised medical advice. Always speak to your GP, diabetes nurse, or dietitian about your individual circumstances. So let's talk about why honey matters for type 2 diabetes. Type 2 diabetes affects how your body manages blood glucose. Every source of carbohydrate you eat has an impact, and that includes natural sweeteners like honey. Many people assume that because honey is natural, it must be a better choice, but the evidence tells a more complicated story. Honey is made up mainly of fructose and glucose with small amounts of vitamins, minerals, and antioxidants. It does have a slightly lower glycemic index than table sugar, meaning it may cause a somewhat slower rise in blood glucose. But here's the key point: it still raises blood glucose, and 1 tablespoon of honey contains around 17 grams of carbohydrate. That's a significant amount, and it all counts towards your daily carbohydrate intake. Under UK guidance, honey is classified as a free sugar, the same category as table sugar, fruit juice, and syrup. SACN and the NHS recommend limiting free sugars to no more than 5% of your total daily energy intake, and NICE supports this as part of dietary advice for people with type 2 diabetes. So honey doesn't get a special pass just because it comes from bees. There's also no strong clinical evidence that honey offers meaningful advantages over other sugars when it comes to managing blood glucose. It isn't a healthier alternative to sugar for people with type 2 diabetes, and consuming too much can make blood glucose control harder. That said, individual responses do vary. Your medication, your overall diet, and how well your glucose is currently controlled can all influence how your body responds to honey. So what can you actually do with this information? If you're keen to use a sweetener, it's worth discussing non-nutritive options with your doctor or dietitian. Sweeteners like stevia and sucralose don't raise blood glucose and don't add calories, making them more suitable alternatives for most people with type 2 diabetes. Just check the label, as some products include bulking agents that can contribute a small amount of carbohydrate. If you do choose to include honey occasionally, keep it to no more than a teaspoon at a time, and always count it within your daily carbohydrate allowance, not in addition to it. If your diabetes care team has recommended self-monitoring, testing before and after can help you understand your own personal response. When should you seek help? If your blood glucose readings are consistently above your target range, if you're struggling to manage your carbohydrate intake, or if you're unsure how your diet interacts with your medication, especially if you take insulin or sulfonylureas, speak to your doctor or diabetes care team before making changes. So to recap, honey raises blood glucose and is classified as a free sugar under UK guidance. It isn't a healthier alternative to sugar for people with type 2 diabetes. If used at all, keep portions very small and count them within your carbohydrate allowance. Non-nutritive sweeteners like stevia are generally a more suitable option, and always speak to your healthcare professional before making changes to your diet. I'm Aisha from Bolt Pharmacy. If you found this helpful, please give it a like and subscribe for more evidence-based health content. Drop your questions in the comments below. We'd love to hear what topics you'd like us to cover next.